Mr. Speaker.
Order.
Resumption of debate on the motion Singapore's COVID-19 response.
Deputy Prime Minister, Minister of Finance.
Mr. Speaker, I thank all members who have spoken and for sharing your views on Singapore's response to COVID-19 and on this motion. We've also received feedback from the public on the white paper, and many Singaporeans agreed with the broad observations and lessons and gave us further ideas on how we can strengthen our defenses against future pandemics. We take all of the feedback and suggestions seriously, and we will study them carefully. In their speeches, my colleagues have shared several specific moves that MOM, MOH and MTI have made and will soon be undertaking. Our work will not end with this debate. We will continue to consider additional inputs, put our plans into actions, and adjust them along the way. This is an ongoing multi-year effort and commitment to learn and to improve. The points raised by members in this debate can be summarized into three broad themes. First, preparing for the next pandemic. Second, ensuring effectiveness of our spending. Third, upholding solidarity and trust. So let me address each of these in turn. First, as I highlighted in my opening remarks yesterday, the purpose of the white paper and this debate is for us to learn, improve, and be better prepared for the next pandemic. And I'm glad that the leader of the opposition, Mr. Pritam Singh, agrees with this and supports the motion. I do note, though, that Mr. Singh, in supporting the motion, said, and I quote, he supports the motion to the extent it expresses gratitude to all in Singapore who contributed to the fight against COVID and affirms the government's efforts to learn from the lessons of the last 3 years. Now, I may be mistaken, and if so, please pardon me, but this suggests that it is a qualified support. To the extent suggests that it is a qualified support. I'm not sure why there is a need for such qualification, because after all, Mr. Singh himself did highlight the need for us to set aside politics, to close ranks, and to uphold unity of purpose in a crisis, which I fully agree with. So I would urge Mr. Singh and the Workers' Party to give us their full and unreserved support so that we can truly demonstrate unity of purpose in dealing with and learning from this pandemic. Perhaps Mr. Singh had held back his support, his full support, because of the questions he asked about the report prepared by Mr. Peter Ho. So let me explain. The government had asked Mr. Peter Ho in late 2021 to undertake a review of our COVID experience from the start of the pandemic until August 2021 and to draw lessons from this. At that time, we had envisaged it as an interim or mid-term review because we were not clear when we would be able to fully transition to endemic COVID. In parallel, various government agencies embarked on their own after-action reviews or AARs. These focus on the policy and operational decisions within their respective domains. Mr. Ho knew about these reviews and he decided to focus his efforts on the key strategic lessons for the government so as to minimize duplication and to complement the agency AARs. By the time Mr. Ho's report was completed, we also had further experiences with the fast-changing COVID threat, including the implementation of the Home Recovery Program and our responses to the Omicron variant in late 2021. And by then, we were also clearer about the way out of the pandemic because the situation had stabilized and we could envisage a full transition to endemic COVID. There was therefore a need to pull together the findings from Mr. Ho's interim report and the agency's AARs, as well as the lessons from our more recent experiences, into a consolidated report that would fully reflect all that had transpired over the last 3 years and provide a fuller synthesis of all our learnings. And that's why PMO, the Prime Minister's Office, was tasked to put together this consolidated report, which the government decided to release as a white paper. Now, some may ask, if that's the case, why can't you release Mr. Ho's findings? And if it's deemed sensitive, why not have it redacted with the non-sensitive portions released? But that is precisely what we have done. Whatever is relevant and fit for release, we have incorporated into this white paper. And the white paper is, in fact, more comprehensive than what Mr. Ho's review had set out to cover, because it includes information from the agency's AARs, as well as learnings from our experience after August 2021. The white paper will not be the final word on our COVID response. I'm sure academics and experts will continue to undertake more detailed studies, like the one mentioned by Mr. Leon Pereira on our H1N1 pandemic response. Incidentally, that study was done by MOH public health officials. They decided to publish their findings in an academic journal. So we welcome all academics and experts to do their own detailed assessments of our COVID response and to put out their findings. They may have a different conclusion and view from the government on specific issues like wearing of masks, border measures, or SMMs, and that's perfectly okay. In fact, we welcome the diverse perspectives because this will help us challenge our own assumptions and learn and improve. Our members generally agreed with the broad thrust of the white paper and offered many useful suggestions to strengthen our capabilities and support frameworks. Clearly, there's much work to be done across all domains. In healthcare, we need to build up our primary care and hospital capacities, our vaccination capabilities, as well as our public health expertise, as several members highlighted, including Mr. Leon Pereira, Dr. Tan Wu Ming, Mr. Mark Che, amongst others. In economic resilience, as Mr. Sean Huang, Mr. Seah Kian Peng, Mr. Melvin Yong, Mr. Sakyandi said, we need to invest in alternatives like local production, diversify our import sources, and strengthen the robustness of our infrastructure and transport links. And I would also like to assure Ms. Janet Ang, Mr. Raj Joshua Thomas, and Mr. Desmond Chu that we will continue to harness the strength of our tripartite model, our trade associations and industry partners in all of these efforts. We need to do more to improve public communications, including frontline crisis management comms, as suggested by Ms. Jessica Tan and Ms. Herting Rue. And we need to do more to look out for and care for the more vulnerable amongst us, including our migrant workers, and to address mental wellness issues, especially for our youth, something which many members, including Ms. Ng Ling Ling, Mr. Edward Chia, Mr. Yip Hon Wing, Mr. Gan Thiam Poh, Ms. Her, Mr. Louis Ng, and Ms. Rachel Ong all made reference to. We recognize that the government cannot do all of this work alone. We will need to work more closely with the people and private sectors. We will go beyond the usual corporate and tripartite partners to involve other stakeholders, including community groups and NGOs. We will involve our partners not just in execution and implementation, but also in upstream planning and emergency preparedness. So we will follow up on all of these systematically in order to strengthen our crisis management muscles, something that Ms. Po Lee San and Ms. Cheng Li Hui highlighted in their speeches. I also agree with all members that this work is of great urgency. Around the world, the risk of animal viruses spilling over to humans continue to rise due to population growth, urbanization, and increasing proximity to animals. Climate change has exacerbated these problems by generating more habitat loss, forcing wildlife to migrate out of their usual patterns, and coming into contact with new species and more people. In other words, disease spillovers and outbreaks are inevitable. Just in the summer of 2021 alone, when we were all focusing and grappling with COVID, WHO received alerts on more than 5,000 new outbreaks around the world, few of which made global headlines. Because most spillovers lead to smaller clusters of disease that quickly die out. But every now and again, we encounter a pathogen that becomes a pandemic, causing global chaos. The urgent global task, therefore, is to reduce the spillovers and, importantly, to prevent any such spillovers from turning into pandemics. And this is where early detection is of utmost importance. And that's why there is a crucial need for an enhanced global surveillance system, especially in potential hotspots around the world. And with early knowledge of the characteristics of the new pathogen, along the dimensions that Minister Ong just shared just now, and if we know this before the virus reaches our shores, we will be able to buy precious time to decide on our posture and measures. And that's why Singapore is plugging fully into the global network of international pandemic research, and we are working hand in hand with the global community to improve our collective pandemic response. Singapore was a co-chair of the Friends of the COVID-19 Vaccine Global Access, or COVAX, facility, which helped countries in need secure access to COVID vaccines. The G20 recently set up a Global Health Security Financial Intermediary Fund, or what is now called the Pandemic Fund, to ensure more reliable financing for future pandemics. Singapore was one of the founding contributors to the fund, and we continue to shape initiatives through our membership of the G20 Joint Health and Financing Task Force. And as Minister Ong shared just now, we will continue to leverage GZ to keep up to date with genome sequencing of pathogens with pandemic potential, and we are also a part of the Coalition for Epidemic Preparedness Innovations, or CEPI, to keep up to date with vaccine developments. We also have professionals and specialists from our scientific community who represent us on technical platforms at the WHO and other international bodies. So we are doing everything we can to be better prepared, not just within Singapore, but also internationally. Next, let me touch on the overall effectiveness of spending in enabling Singapore to get through this pandemic. And Ms. Hazel Phua had asked about this. At the macro level, governments around the world grappled with the twin challenges of lives and livelihoods. And so, with your permission, may I display some slides on the screen?
Please do.
In terms of lives, as at 31st December 2022, our mortality rate for COVID-19 was around 300 deaths per million. We mourn every death and express our deepest condolences to their families and loved ones. But what we have in Singapore is much lower compared to other countries with 5 or even 10 times mortality rate. The key reason for this is that we did not allow our hospitals to be overwhelmed, as Minister Ong had explained just now. And that was always our key objective throughout this crisis. And so we made full use of the tools at our disposal, whether it's vaccinations and boosters, border measures, or SMMs, to achieve this goal. This is on mortality rates. It's not excess mortality, just looking at mortality from COVID as one measure. In terms of livelihoods, our economy recovered quickly to pre-COVID levels by 2021. Our employment rates today are even higher than pre-COVID. Our recovery, very hard to put this into a picture, so I don't have a chart for this, but our recovery was faster compared to many other economies. And you can use different indicators to track this, but it's quite clear our recovery was faster compared to many others. These are, of course, not comprehensive outcome indicators, but I think most would agree that they are among the more important ones. How much did we spend compared to other countries to achieve these outcomes? As I mentioned yesterday, we had budgeted more than $100 billion, and we eventually spent $72.3 billion over financial year 2020 and 21, which is equivalent to about 15% of our FY 2020 GDP, which you can see on this chart. So we mounted a strong response. What did other countries do? It's not so easy to get actual data from other countries, but the IMF has some estimates, so we put out what the IMF has estimated for the different countries. And clearly, we are not the lowest in terms of this chart, the sampling of countries, but certainly we are not excessive either. And there are many countries like the US, UK, Japan, and Germany, which put out much larger fiscal packages. So for the amount of public funds spent, we achieved relatively good outcomes compared to other countries. There were other achievements. I've highlighted mortality rates, economy, but there were other achievements that were not so easily quantifiable, but no less important. For example, we kept schools physically open and education going for our students. We minimized disruptions to in-person learning, particularly for younger students, and mitigated the potential loss in learning outcomes due to the switch to home-based learning. This was not the case in many other places where lengthy school closures had long-term scarring effects in terms of human capital development, particularly for students from less advantaged backgrounds. We kept businesses afloat and local unemployment rates low through the job support scheme and other financing support. This helped to preserve firm capabilities and allowed businesses to bounce back quickly when the worst of the crisis was over. And through the SG United Jobs and Skills package, we also helped those who were in between jobs transit to growth sectors, and fresh graduates maintain their skills and human capital while waiting for the economy to pick up. And we kept supply chains open throughout the crisis and continued to service the world as a transshipment hub for air and sea cargo. Even at the height of the pandemic, when many countries, including Singapore, were short of supplies, we never imposed export controls. Vaccines came through our airport. We had cold chain facilities, so we facilitate the shipment of vaccines to the rest of the region. This not only enabled supplies to keep flowing to and through Singapore, but also boosted our reputation as a reliable and trusted node in the global network. So on the whole, when you look at all of these outcomes and what we had spent, on the whole, compared to other countries, we've achieved good value for the monies we spent to stave off the most severe downsides of COVID-19 and to mitigate long-term economic and social scarring. The resources we deployed enabled us to buy insurance and options, sometimes at substantial cost, like what we did when we moved quickly to secure advance commitments for the vaccine supplies. Not every insurance option will pay off, but in the end, we have to judge whether it is worthwhile to pay a bit more so that we can be in a stronger position to deal with the crisis and head off potentially very costly downside scenarios. And when you look at what we have achieved overall in this crisis in the last 3 years, I am convinced that on the whole, it is money well spent. Beyond the macro picture, we can, of course, drill down into specific areas of spending. And this is being done through the various ongoing reviews and audits. And I'm sure through these processes, we will pick up areas where we could have done better. But I should acknowledge and give credit to all our public officers who worked hard round the clock to administer and implement the various schemes. There may have been occasional lapses in their work, but I hope members understand that all our officers were working under crisis and emergency scenarios. Where there are lapses or mistakes, I have every confidence that our ministries and agencies will learn from them and will do better the next time. More than 80% of the government spending went directly to beneficiaries, as I mentioned, to keep businesses going, preserve jobs for Singaporeans, and help those who were hard hit by the pandemic, especially the vulnerable. Ms. Phua had asked whether we could have been more discriminating in the support we had extended to businesses, or, for example, to recover payments from businesses that were profitable. And we significantly expanded the job support scheme during the circuit breaker. At that time, remember, at that time, everyone was worried. Businesses were very worried over whether they could survive and how they may retain and pay their workers. And that's why the JSS was designed to be across the board and automatically disbursed so that businesses, especially the SMEs, could receive the much needed support quickly. And indeed, a timely cash flow enabled firms to retain their local employees and capabilities and to bounce back from the crisis once demand recovered. As soon as we could, we started to tier the JSS support, different levels of support for different industries, and eventually phase out the JSS support. MOF had earlier published a study on the impact of our key COVID-19 measures. Our estimates show that 165,000 jobs were saved in 2020 as a result of JSS. Behind this aggregate number are real Singaporeans and their families. And I'm glad we helped these workers to stay employed, earn their keep, and support their households throughout the crisis. Sir, at every point, we tried our best to help fellow Singaporeans retain their livelihoods and live their lives with as much normalcy as possible under the shadow of the pandemic. Mr. Gerald Giam asked about Temasek's involvement in our efforts to fight COVID-19. As I had explained earlier, more than 80% of government spending went directly to beneficiaries. Another 10% was for grants to medical providers, and the remaining 10% was for procurement with third parties. So talking first about government spending, this is the breakdown. Out of the 10% of procurement, most of it, in fact, went to non-Temasek entities. For example, most of MOH's partners in the COVID treatment facilities and vaccination centers were non-Temasek entities. Temasek's entities were involved in very specific operations. For example, in the swift setting up of the COVID facility, the community care facility at the Expo. And that was invaluable because it helped us to get through the very difficult situation we faced with the dormitory outbreak. Then what about the resources that Temasek itself spent on COVID? For example, the distribution of test kits and masks. This comes from the portion of its positive wealth added returns that Temasek would set aside for community initiatives in the Temasek Foundation. The resources for this comes from the portion of its positive wealth added returns that Temasek would typically set aside for community initiatives in the Temasek Foundation. This is part of Temasek's CSR, to do good and give back to society. It's something which we encourage for all companies in Singapore to be good corporate citizens. And over the last 3 years, because we were fighting a crisis, Temasek redirected a significant proportion of these community funds to support the fight against COVID. This is a decision that Temasek and its board made independently of the government, and there is no draw on past reserves from such spending. What Temasek's community initiatives do, Temasek's community initiatives do not in any way detract from its mandate, which is to deliver long-term sustainable returns. Temasek and its portfolio companies operate independently as commercial entities, but like all commercial entities, we welcome them to do their part in a crisis where it really should be all hands on deck. So tapping on Temasek's capabilities as well as that of the broader private and people sectors is just one way we have harnessed our whole of nation resources to help bring our society and economy back to normality. This is not a form of dependence or over-reliance by the government, which Mr. Giam seems to suggest, but really a manifestation of Singapore's distinct and unique strength. In fact, many other countries struggle to galvanize their private sector to contribute to pandemic fighting efforts. In contrast, we were able to harness public and private resources to fight the crisis. We worked closely with all stakeholders to ramp up vital services and to make up for shortfalls. And that is what good governance is about. It's about how well we organize ourselves and marshal resources across the public, people, and private sectors, and how we mount responses and deliver the best outcomes for Singapore and Singaporeans. In the end, dealing with a national crisis requires a whole-of-nation approach. And so we hope that partners from all segments of society can come together again in any future crisis. And we welcome the expertise and contributions from all companies and organizations, whether they are Temasek-linked or not. Finally, no matter the shape and form the next virus will take, there is one element that is crucial in shaping our response, and that is trust. Singaporeans trusted the government to make the right decisions and to act in the best interest of Singapore and Singaporeans. The government did not take this trust for granted. We were open and honest throughout the crisis. We shared information candidly, even when things did not go well and even when we did not have complete information. This was essential so that Singaporeans could continue placing their trust in the government. Equally, if not more important, the trust amongst Singaporeans has been strengthened. This is not the case in many other places where trust amongst the citizens had been declining even before COVID-19 and may even be at historic lows today post-crisis. And hence, during the pandemic, it was hard for these governments to implement tough COVID measures. After all, if trust is low, then people may say, why should I comply with your measures? Because if my neighbors or my friends are not complying, then why should I do so? And so you can see this is what has happened in many other places where there is little trust. Public health becomes politicized and individualized, and the country's pandemic response is quickly compromised and impaired. Fortunately, social capital and trust have been high in Singapore over the decades, and the silver lining in this terrible crisis is that social capital and trust have increased. A post-COVID survey or post-3-year survey commissioned by the Ministry of Communications and Information showed that social capital grew over the course of the pandemic. Most notably, trust amongst citizens strengthened. More than 7 in 10 Singapore residents felt that their relationships with their neighbors and friends remained the same or became stronger during the pandemic. A similar proportion of respondents were confident that the government would know what to do in a future pandemic and that Singaporeans would help one another tide through the next crisis together. We are heartened by these survey results. This trust is extremely precious, and we will work assiduously to preserve and strengthen it so that Singapore will always remain a high-trust society. Mr. Speaker, I shared in my remarks yesterday that it's important we approach the lessons from our COVID-19 experience with the right attitude and mindsets. Lessons learned should never be hard-coded into doctrine. Lessons should not be blindly applied from one crisis to another because while there may be similarities, there will also be differences. The key is to have the flexibility and wisdom to adapt and devise solutions that are fit for purpose and fit for the situation at hand. Indeed, through this COVID-19 experience, we have expanded our toolkit to manage disease outbreaks and pandemics. For example, look at border measures. We now have a wider range of measures to apply at the borders. We can impose not to land, NTL, which is the most stringent. We can allow travelers to enter Singapore subject to test, and the tests can be pre-departure tests, can be on-arrival tests. We can allow them to come in subject to both test and quarantine, and the quarantine can be done at home or in quarantine facilities. And if it's done at home, we have improved the system now so that with electronic tagging and remote monitoring, it is quite effective. So just thinking about the kinds of border measures we have from SARS till now, we have really expanded our toolkit considerably. For SMMs, we have identified the 5 key parameters which are important: group sizes, mask wearing, workplace requirements, safe distancing, and capacity limits. So hopefully, if we ever have to do this again, it will not be as confusing and complex as we had in these last 3 years. But by tweaking and adjusting these 5 parameters, we will be able to manage transmission risk depending on the severity of the threat. So be it surveillance, border measures, SMMs, testing or vaccine development, we have a wider range of policy options and measures to tackle the next pandemic. And with our enhanced capabilities in detection, surveillance, identification of threat, which we are doing not just by ourselves, but hand in hand with international partners, we will be in a much better position to protect ourselves and deal with the next pandemic if and when it comes. We will not stop here. We will continue working hard to expand our toolkit and to build up our capabilities, because ultimately, that's the best way for us to honor the dedication and sacrifices that everyone had made to fight the pandemic these past 3 years. And that's why we acknowledge with humility the learnings and points of improvement as a country, a people, and a government. We pledge to keep on doing better and be better prepared if and when the next pandemic strikes. And at the same time, we are grateful and thankful for all the positives that we have seen and experienced these past 3 years. The dedication of our healthcare and other frontline workers, the acts of kindness within our communities, and the solidarity and trust of our people. So we know that the road ahead of us will always be unpredictable. We have focused in this debate on pandemic threats, but there will be other challenges. Sometimes it almost feels like the next crisis is just around the corner. We've got uncertainty now in the global economy and financial markets. We've got geopolitical tensions, superpower rivalry in Asia, climate change, and the list goes on. There is no guaranteed formula to navigate these challenges, but if Singapore and Singaporeans take all that we have been through these past 3 years to heart, we will be able to overcome any challenges that come our way and prevail as one united people. Mr. Speaker, I beg to move.